Okay, so we have our very first interview here at the EACD conference. I have the fabulous Dr. Amanda Kwong from University of Melbourne. Welcome.
Thank you so much, Dana.
Now, you just come back from your presentation, so you're literally just buzzing off that. And you've come down, sat down to have a chat with me about the work that you've just presented. So tell me a little bit about, before we talk about that work, in general, like what is it that you do? Obviously, you're a researcher, but what brought you to this place in the first place?
Yeah, absolutely. I'm a physiotherapist by trade,
Nice.
and I've always had an interest in paediatrics, working with children. I think I can't quite put my finger on the link, but I did have a very close family friend with Down syndrome, I saw what she did at her special school, and then there were a few, and I thought that was pretty cool to be able to uplift people with a disability in that sort of setting.
Yeah.
And then I saw a few documentaries of, kids who'd had car accidents and neurological injuries as a result. And I just thought, oh, gee, that'd be so awesome to be able to help to return a child back to, functioning. But then I worked clinically in Canberra for a little bit with the Child Development Service there.
Yes.
But Melbourne is my home, and I moved back to Melbourne. And when I moved back, I thought I want to do something a little bit different, but not too different. So I approached Professor Alicia Spittle and asked her if she was supervising any PhD projects, and she mentioned that she was looking at general movements and a smartphone app to do with that. And I find myself a bit drawn to technology as well.
That's
so I thought
cool.
This is just a wonderful collision of two worlds here of children, disability, physiotherapy, technology, and the rest is history. So, yes.
That is such a great story. So I love that you worked clinically, but you're inspired through that process and wanted to go that little bit deeper and something different. And research is often a nice place to go to, isn't it? It kind of opens your horizons to so many different things.
Yes.
And it takes you to places like this. And so, that we get to meet in Slovenia. So tell us in a bit of a nutshell, sort of what is the study that you presented today and what you had for the oral communication?
Yeah, so I presented our work on the KiTE CP study. So that's the knowledge translation of the early detection of cerebral palsy.
Great.
KiTE CP is much nicer to say.
Yes.
And that is all about looking at implementing the current clinical guidelines for the early diagnosis of cerebral palsy.
Great.
In high-risk infant settings. And so we worked with 11 sites across Australia. So it's quite a big study, and we worked with sites in Brisbane, Sydney, as well as Melbourne, and looked at implementing the early detection of cerebral palsy guidelines in those settings.
That is wonderful. So the early detection guidelines, we've spoken a bit about that before in the podcast, but can you just describe like a high level sort of summary? I know it's a hard one to summarize, but what's in that? What are the main principles that are part of that early detection process?
Yeah, so I can't say this without mentioning Ina Novak and her colleagues who devised these clinical guidelines through some really great evidence that had come before it. But essentially it is a triangulation or looking at three different assessment tools. So one of them is the Hammersmith Infant Neurological Examination, which is a hands-on assessment for babies. If they score below a particular number, then it puts them at high risk of cerebral palsy. So that's the HIND, number one. Number two is the general movements assessment. And so that's my little pet project, the general movements assessment, and making sure that families have better access to this assessment. And that one, if you have a baby that has abnormal movements on that, then that is a second indicator for high risk CP. And then the third one being changes on brain neuroimaging. So if you get 2 out of the 3 of HIND, general movements, or brain neuroimaging, that puts you at high risk of cerebral palsy.
That's such a great summary. You did that very well. You've obviously done that before. That was actually really nicely done. So in terms of the knowledge translation aspect of it, what was the main task that you had set before yourself?
Yeah, so as we know, we can all write beautiful guidelines and it takes some time for clinical practice to catch up.
Yeah.
And so that was the purpose of this exercise, was to try to implement these guidelines and use a knowledge translation strategy. So I have some colleagues at the University of Melbourne and the Murdoch Children's Research Institute that are knowledge translation experts.
Yeah.
And they devised a bit of a strategy in combination with clinicians as well to see what would work in terms of implementing the guidelines. So we didn't just say to people, you need to do an MRI, you need to do a Hind, and you must do the general movements assessment.
Sure.
We said to them, we'll support you with continuing medical education. We'll supply you with a smartphone app that you can use with your families to help so the Baby Moves app to try and help to record the general movements assessment. We can provide you with a peer network as well. So I know in Victoria we had a general movements interest group that was set up around this project. And we're yet to find the full results of it just yet. But today what I presented on was how the uptake of the general movements assessment specifically as part of the 3 points of early diagnosis.
Yes.
And we found that if we did it in a way that's relevant to a local setting that works within what is existing with them, plus giving them with a little bit of support, we're getting a lot more videos back from our parents or getting general movements assessment videos. It might not necessarily be the app, so we found that only 64% of our participants use the app.
Really?
So that it's not a high rate compared to our other studies, but because we allowed other ways of collecting the video, we actually had an overall general movements assessment rate of 92%.
Wow.
So, yeah.
I guess that really speaks so much into providing people with choices and being able to identify something that works for them. I think sometimes maybe a little while back when we used to talk about knowledge translation, it was kind of like, this is what you must do and this is the process you must follow it by. And I think what happens from that is we treat clinicians who can think and bring up so much information together. It becomes very technician-like. Yes. Whereas, there is problem solving, there's thinking around that, and that makes things more robust.
Yes.
Yeah.
Absolutely.
So I love how that has come through in some of your results. Was there anything that surprised you in your results in particular?
I think so we sort of, this needs a little bit more hashing out with our next research studies that will come out of this. But we started to look into the barriers, and we're sort of starting to hypothesize the barriers to the implementation, even though we did as best as we could to support each clinical site to implement these guidelines. There was still some staff hesitancy as well. They might not have been directly involved with a KiTE CP study. But there might have been someone in the staff network that just wasn't quite convinced yet, and we're not sure how much of a barrier that was, but we're going to look into it next. My colleague, Dr. Kate Cameron, she's about to look into the clinician perspective as well as the parent and family perspective of the early screening process. And that's going to unpack a whole lot more stuff for us.
Yeah. I think understanding those elements is so important so you can develop strategies and actually just know what the micro steps might be to get into that. So ultimately, I guess I can see where it's probably wanting to be headed, but ultimately, where is it that your team want to see this whole program?
I guess that we see the end goal is that that the early detection of cerebral palsy and screening for cerebral palsy is implemented universally across Australia to start, but then next worldwide as well. And I do believe that there is a push for cerebral palsy to be screened early in a worldwide context as well.
That's so fabulous.
I think it's it definitely can be done, but there's a lot of hurdles to get in the way, which we can absolutely jump over given the right resources.
Yeah, for sure. Okay, well, let's just finish off with maybe some top tips. Do you have any top tips on how we can support more knowledge translation in this early detection field? You've kind of covered it a little bit, but let's just put it down to just a few points. Do you know what they might be? Do they spring to mind?
Yeah, I think my colleague Dr. Abby Eales, who's the knowledge translation expert on our team, would be able to articulate this better. And also we haven't quite delved into it, but I would hypothesize that the things that would help people implement things is really that peer-to-peer support.
Okay.
And I feel like if you get that sort of momentum going behind uptake of something like the cerebral palsy screening guidelines, then you can't help but take your colleagues with you, and hopefully the way the early conversations with the team, expanding through to people like the nursing staff and other junior medical staff as well, that those early conversations about cerebral palsy become much more sophisticated, much more understanding and gentle with the parents and families. And that way that we can get that sort of uptake happening a lot more better.
Yeah, that's great. And that sort of brings to a point, I guess, even when you're saying that, is sometimes it's the soft skills. It's those interpersonal communication aspects that bring people with you. It creates that environment for people to feel confident. And I think that, you know, sometimes we need to build people's confidence up to be able to take on something that's new, right?
Yes.
And that can't be underestimated, because I think that's how a lot of us want to learn.
Yes, absolutely.
You don't want to venture it on your own.
No, we're pack animals. Yeah.
No, that's great. Well, congratulations on your work. Congratulations on being able to present that work here today. And thank you for your time here on the podcast.
Thanks so much, Dana.
I loved it. All right, guys. So that's the first episode. So stay tuned for more. And if you have any questions, remember you can send us an email or contact us through the website researchworks.net. Talk to you guys all again really soon.